Lymphoma is a type of cancer that affects the lymphatic system, a crucial part of the body's immune defenses. The lymphatic system is a complex network of vessels, tissues, and organs. It helps to filter waste and fight infections. Lymph nodes, small bean-shaped organs, are key components of this system. They are found throughout the body. Lymphoma originates in a type of white blood cell called lymphocytes. Lymphocytes are essential for a healthy immune response. They help the body recognize and attack foreign invaders like bacteria and viruses. However, in lymphoma, these lymphocytes begin to grow and multiply uncontrollably. This abnormal growth leads to the formation of tumors within the lymphatic system. There are two main types of lymphoma: Hodgkin lymphoma and non-Hodgkin lymphoma. Hodgkin lymphoma is characterized by the presence of Reed-Sternberg cells, which are large, abnormal lymphocytes. Non-Hodgkin lymphoma, on the other hand, encompasses a wider range of subtypes, each with its own distinct characteristics and behavior. Lymphoma can develop in lymph nodes anywhere in the body. It can also affect other organs and tissues where lymphocytes are found, such as the spleen, bone marrow, and thymus gland. The specific symptoms, treatment approach, and prognosis for lymphoma can vary depending on the type, stage, and overall health of the individual. Lymphoma can manifest with a range of symptoms, often mimicking those of common illnesses. Swollen lymph nodes, particularly in the neck, armpits, or groin, are one of the most frequent signs. However, these enlarged lymph nodes are not always painful and may go unnoticed in the early stages. Other common symptoms include fever, night sweats, unexplained weight loss, persistent fatigue, and itchy skin. Some individuals may also experience shortness of breath, chest pain, or abdominal discomfort, depending on the location and extent of the lymphoma. It's important to note that these symptoms are not exclusive to lymphoma and can be caused by various other conditions. Diagnosing lymphoma typically begins with a thorough physical exam and a detailed medical history review. Blood tests are essential to evaluate blood cell counts, liver and kidney function, and to look for specific markers associated with lymphoma. Imaging tests, such as X-rays, Connecticut scans, PET scans, and MRI scans, help visualize the affected areas and determine the extent of the disease. The definitive diagnosis of lymphoma requires a biopsy, which involves taking a small sample of tissue from an affected lymph node or organ. A pathologist then examines the tissue under a microscope to confirm the presence of cancerous cells and determine the specific type of lymphoma. Once diagnosed, lymphoma is staged based on its spread within the body, ranging from stage 1 to stage 4. The treatment landscape for lymphoma has evolved significantly, offering patients a wider array of options and improved outcomes. The specific treatment plan for lymphoma is tailored to the individual and depends on factors such as the type and stage of lymphoma, overall health, and prior treatment history. Chemotherapy, using powerful drugs to kill cancer cells, remains a cornerstone of lymphoma treatment. It is often administered intravenously or orally, either alone or in combination with other therapies. Radiation therapy, which uses high-energy beams to target and destroy cancer cells, may be used to shrink tumors or eliminate remaining cancer cells after chemotherapy. Targeted therapy is a more precise approach that focuses on specific vulnerabilities within cancer cells. These drugs work by blocking the growth and spread of lymphoma cells while minimizing damage to healthy cells. Immunotherapy, a rapidly evolving field, harnesses the power of the body's own immune system to fight cancer. Immune checkpoint inhibitors, CAR T-cell therapy, and monoclonal antibodies are examples of immunotherapies that have shown promise in treating lymphoma. In some cases, a stem cell transplant may be recommended. This procedure involves replacing damaged bone marrow with healthy stem cells, allowing for higher doses of chemotherapy or radiation therapy. The choice of treatment or combination of therapies is carefully considered by a multidisciplinary team of specialists to ensure the best possible outcome for each patient. Recent advancements in lymphoma treatment offer renewed hope for patients, improving survival rates and quality of life. New drug approvals, particularly in the realm of targeted therapies and immunotherapies, are expanding treatment options and providing more effective ways to combat the disease. CAR T-cell therapy, a groundbreaking immunotherapy, has shown remarkable success in treating certain types of lymphoma. This personalized approach involves genetically modifying a patient's own T-cells to recognize and attack cancer cells more effectively. Ongoing research and clinical trials are further refining CAR T-cell therapy protocols, improving its effectiveness, and expanding its applicability to a wider range of lymphoma subtypes. Genomic profiling, which involves analyzing the genetic makeup of an individual's lymphoma, is playing an increasingly important role in personalized medicine. By identifying specific genetic mutations driving the cancer's growth, doctors can tailor treatment plans with greater precision, selecting therapies that are most likely to be effective. Promising clinical trials are ongoing, exploring novel agents, innovative combinations of therapies, and next-generation immunotherapies, paving the way for even more effective and targeted treatments in the future. While lymphoma can be a challenging diagnosis, it's important to remember that advancements in treatment are continuously being made. The prognosis for lymphoma varies depending on the type, stage, and other individual factors. With early diagnosis, a comprehensive treatment plan, and ongoing support, many people with lymphoma can achieve long-term remission and live full and active lives.